Iowa lawmakers are considering priorities put forward by Governor Kim Reynolds aimed at boosting maternal health in the state. Local 5's Mary Sugden joins us from the State House with what's on the table.
Yeah, Stephanie, this morning the Senate Health and Human Services Subcommittee pushed forward a measure that's really focused on child and family health outcomes. And what we heard from advocates and lobbyists at this group is that they feel that this measure is a good first start, but could do more. Under Senate Study Bill 1139, state employees would get paid parental leave, 4 weeks if the employee gives birth or adopts, and 1 week if they're the supportive partner.
If you look at the research, 6 weeks is when you really start to see some of the benefits in terms of maternal mental health, in terms of return to workforce.
Lobbyists saying while the 4 weeks is a start, they'd ideally like to see 6 to 8 weeks.
Many child care centers don't accept infants before 6 weeks, and that's particularly important in Iowa, where we have the highest rate of having all parents of a household in the workforce.
While the House version of this bill contains expanded access to contraceptives, the Senate version does not.
The American Journal of Public Health did a study from 2008 to 2014 and showed that abortion rates decreased by 25%. This decrease was largely attributed to an increase in contraception access.
The bill would also allocate $2 million from the general fund to the MOMS program, which was first created last session. Supporters of the statewide program say it helps promote healthy pregnancies through nonprofits, which can offer women support, education, and counseling. But Planned Parenthood says these centers are unregulated and misrepresent themselves as legitimate medical providers.
Their goal is to dissuade people from obtaining an abortion, often by providing misinformation that is meant to scare or shame them. From calling a patient's family members to inform them of an intent to terminate a pregnancy, to misdiagnosing a deadly ectopic pregnancy as healthy and viable.
And something else that came out of this meeting is that last year the state allocated $500,000 to this MOMS program, but an HHF rep at the meeting basically confirmed that none of this money has been spent at this point on direct services. He says that staff are really still working on an RFP on basically how those services will get delivered. Live at the State House, Mary Sugden, Local 5 News. Stephanie, back to you.
All right, Mary, thank you.